all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Hello dear friends, good evening. We are back with yet another episode of BMC Global Live Al Hilal Health World, nothing but lifestyle. This is a talk show with the expert doctors of Al Hilal hospitals and medical centers. The diagnosis of diabetes in children can be overwhelming for the parents, especially in the beginning. But don't worry, we have with us Dr. Goutham A Shivananda from Al Hilal Hospital, Muharraq. He is a specialist pediatrician with an experience of more than 8 years, and I hope he will clear all our doubts about diabetes in children. So, doctor, welcome to the show.
Pleasure to be with you.
And thank you for being with us today.
Yeah.
So, doctor, how do you define diabetes, and why is it very important for us to be concerned about this disease now?
The importance of diabetes is, we may think diabetes is there in pediatric age group. No, it is very common. I would say it is 1 in 300 children has diabetes, and the diagnosis is often missed or diagnosed later, which will lead to many complications. If you ask me what is diabetes, diabetes is a metabolic disease which is associated with excessively high blood sugar levels, what we call blood glucose. It happens because if there is no insulin in the body, or there is no utilization of insulin in the body. So, these are two conditions which contribute for the disease.
Now, we would like to know about the symptoms of diabetes.
The symptoms of diabetes are directly correlated to the high blood sugars in the body. Whenever there is a high blood glucose levels, we see variety of symptoms like increase in thirst, increased urination, rapid weight loss, blurring of vision and fatigability. Sometimes the symptoms are very mild, parents may think it goes, they may not even recognize these symptoms. This happens because the increased blood sugars in the bloodstream, to eliminate these sugars, the kidneys have to overwork. When the kidneys overwork, they produce a lot of urine just to throw the excess sugars outside. This increased urination produces increased thirst, but parents may confuse it to the baby is not drinking water, and that's why there is increased thirst. This is a disproportionately misunderstood thing. So that makes the parents ignore it. And because of the increased urination, there is dehydration, which can cause a rapid weight loss. Okay. So this is how the symptoms are connected.
Okay, so when we find the symptoms in children, it's better to go for the medical intervention.
Yeah, but I would say it's always better to do it early. Okay. Like annually you can have a blood sugar checkup, because there are many centers are there which are offering an offer and all. So it's better to do a screening every year or 2 years when you are at increased risk factors. We can talk about these risk factors as we move on.
Yes, yes. Now doctor, what are the complications of diabetes in children?
Essentially, the complications are again related to the high blood sugar levels in the system. So these high blood sugar levels cause a deposition into the various systems of our body. So the children with diabetes are prone to develop nerve damage, kidney damage, blindness, and early heart failure. There is increased risk of stroke as well as amputation of the limbs, because the nerve damage can lead to less pain leads to increased susceptibility for injuries and infections.
Okay. Yeah. Now once diagnosed with diabetes in children, what are the treatment options?
When we diagnose a child, when we label them as a diabetic, that means the sugars are already high. The child is in the final stage of diabetes. During these stages, we can go for various kinds of treatment depending upon the types of diabetes. In type 1 diabetes, where there is no insulin at all, we have to supplement the baby with subcutaneous insulin. And there are various types of insulin available thanks for the genetic engineering. Now we have short acting, medium acting, long acting and ultra long acting, which gives a flexibility in the treatment options. In type 2 diabetes, we do have options of taking the medications orally. We have more than 5 generations of medications and being added more and more and approved by FDA. So this gives a large range of flexibility to help the patients with diabetes and treat.
So is there a pre-diabetic stage for children also like adults?
Yes, we do have pre-diabetic stage. For all ages there is a pre-diabetic stage. Pre-diabetes is defined as a honeymoon phase in a normal terms, because the patient is not aware of what is going on within the system. So the normal range of glucose, say it is fasting blood sugar is less than 90. So that range is crossed, the establishment of diabetes happens beyond 300, beyond 250 to 300. So during those ranges, the child may look normal, act normal, they may be functioning normally, they may not have any symptoms, or they may have only mild symptoms. But over a period of time, this puts the burden on the system. That adds gradually and build it up, then eventually the child expresses a full-fledged symptom of diabetes.
So before the onset of diabetes, we can expect the pre-diabetic stage also.
Exactly. If you ask me how long it takes from pre-diabetes to diabetes, roughly it is around 10 years. Okay. The average time period is 10 years.
Now, can you explain the stages of type 1 diabetes in children?
The stages, we comprise the stages as 3 stages. So these stages include, one is a normal stage. Normal stage means the blood sugar is normal when you check. There is no signs of any raised blood sugars, but when you check immunologically, there are certain detectable antibodies which are already destroying the insulin production centers, that is beta cells of pancreas. So here the child has normal sugars, but even life everything is normal, but immunologically the process is on. This is stage 1. In stage 2, the destruction of pancreas has happened almost 60 to 80%. The beta cells have been destroyed. That leads to less insulin production, and here the sugars are high, but not as high as diabetic sugars. In stage 3, almost there is no insulin, so the sugars are already high, and we also see the symptoms like increased thirst, increased weight loss, urination. These symptoms are there. So this is the stage where clinically we diagnose the child as a diabetic child. So by the time we diagnose, we have missed stage 1, stage 2. So that emphasizes the importance of annual screening of metabolic works in the labs. Yeah.
Now, who all are at the risk of type 1 diabetes? And if in the family type 1 diabetes is there, should we go for the testing for all the children?
Type 1 diabetes risk when recent studies have been guiding that type 1 diabetes is also attributed for genetic factors, but that doesn't mean whoever has the gene develop the diabetes. So there is an association of environmental factor along with the genetic factor. So when a child, I would say, like you say, when the environmental factor, when I mention it, that means there is a hit on the immune system. When the hit on the immune system, it can be because of diet, life changes, lifestyle habits, or it can be because of various viral infections. They modified the immune system in such a way that naturally the immune system fights against the infection, but here the immune system is fighting our own cells. Cells means the beta cells of pancreas. So there the destruction starts, that can contribute for a diabetes. In type 2 diabetes, the risk factors include basically the body obesity. When we say the obesity, the weight is more. When the weight is more, the consumption of glucose is more. To consume more glucose, we want to produce more insulin. So there is a disproportionation between the production of insulin and consumption of insulin. So for example, a 10-year-old child weighs 32 kg, an average 10-year-old child, but if the child is 45 kg, you know, the body has to produce insulin for 45 kg. So there is a mismatch as per the age and the weight. That can eventually lead to overworking of the pancreas. When the pancreas overwork regularly, they eventually fail to work because of the taking too much load on themselves. That causes the insulin to cease, eventually leading to diabetes.
So doctor, now you explained about type 2 diabetes due to obesity in children. Can you make it more clear for us?
Yeah. When we talk about type 1 diabetes, here the concept is very clearly understood. There is no insulin, so glucose levels are high. Whereas in type 2 diabetes, we do have insulin, but it is not being utilized. Non-utilized insulin eventually leads to high glucose levels. Why this mismatch is coming? Because we discussed just now, there is increased weight gain disproportionately, or maybe there is a lack of physical activities. When we do a good physical activity, our cells are working, so that means there are more receptors in the cells which can consume the glucose levels. So the sedentary lifestyle, screen timing, binge eating, these are all contributing factors which eventually make the child go for a diabetes. That is type 2. Yeah.
Now, can I ask, like, is type 1 diabetes preventable?
Type 1 diabetes is not a preventable thing because the factor of onset is very rapid, and nobody has understood the concepts clearly, because there is genetic factor, there is environmental factors. So we don't know when the virus infections, what kind of virus infections can trigger to this situation. So once it happens, it happens. There is no prevention of type 1 diabetes.
Okay.
Whereas in type 2 diabetes, you can consider lifestyle changes, you can consider diet changes, you can also cut down the weight to help the child. Even there are many children who by just lifestyle changes we have modified and the remission has happened completely. Now the child is not at all diabetic.
Okay. Now we know about type 1 diabetes and type 2 diabetes. Are the symptoms the same in both for the children?
In type 1 diabetes, the symptoms are very classic, like increased thirst, increased urination and increased weight loss, fatigability. Whereas in type 2 diabetes, sometimes the sugar levels can vary. Most of the times the symptoms what we see in type 2 are very mild varieties, like fatigability, blurred vision, these kind of symptoms, more of related to the cardiovascular situations like that. So, but if the glucose goes very high like in type 1, they also can manifest similar symptoms like type 1.
Now, can you give us some suggestions for the children with the diabetes to lead a normal life? How can they manage to lead a normal life?
First of all, I want you to understand, all of you to understand that diabetes is not very dangerous if you know what you're dealing with and how to deal with it. All the children of diabetes can lead a normal life. They can eat a normal food, what like any other child eats, and it's very easy to treat. Only thing I want you to stick to the discipline of the treatment. That means the medications has to be appropriately administered. The scaling of medications, when to increase the dose, when to decrease the dose has to be properly understood. A regular follow-ups has to be done with your pediatrician, and also educate yourself more and more. Gain your knowledge about what are the recent advancements to give the best care for your child.
Usually parents are always concerned about the children with diabetes, like they can have medicines like cough syrup. So what is your suggestion?
Like any other food, medications also can increase the sugar levels, because to make it very tasty they have added flavors, they have added sugars in it. So we have a standard formula for scaling up of the insulin when the sugar levels go up. There is a standard ratios, like in food we have, each food has its own carbohydrate ratio. As per the carbohydrate ratio, the dosing of the insulin varies. So you can check your blood sugar levels, how much high it is. As per that, you can take little extra dose of insulin and maintain to the normal level of sugars. Definitely they can have all the syrups, all the medications and all the foods.
Now, what is your advice for the parents with children having diabetes? How should they manage the children's lifestyle, food habits and all?
When the parents get to know their child is diabetic, it's a life-changing situation for them. They don't expect anybody child to go for that kind of illness, because this is not just a small illness like cough, cold or any other infections. This illness is going to be a lifetime illness. So there is a multidisciplinary team to support. We as a pediatrician, we don't only treat the medical part of it, we also take care of the emotional part of it. We counsel the parents, build their confidence back and make them adhere to the treatment, and make them overcome the feelings what they are facing at the time of diagnosis. Over a period of time, many parents, they cope up with it and they even become more confident, because as the child lives normal life with the regular treatments, they are very comfortable with it. So I would say parents not to lose any kind of hopes and not to search for alternate methods or negotiate with the diagnosis. If it is diabetes, it's okay, embrace it, but make your child back to the normal life and give them a proper treatment.
Now, can you explain about the advancements in the treatment options of diabetes?
Over the last few decades, we have a lot of advancement in the field of diabetes. For example, I would say previously we were pricking the child to know the sugar levels like every time before the meal and after the meal. So we take 3 meals a day. So before breakfast, after breakfast, before lunch, after lunch, before dinner, after dinner. So sometimes in the evening also snacks time. So almost 7 times we used to prick the child to know the sugar level. Now we have a sophisticated monitors. It is called continuous glucose monitors. These continuous glucose monitors, they are painless to insert and they are waterproof. A child can take shower, swim and can be inside the dress. There is no pain of pricking. So each continuous glucose monitors can run for 14 to 20 days. So this period of time, the monitor is continuously recording and giving a graphical representation. As a pediatricians, it's very easy for us to understand when the sugar was high, when the sugar was low, and how to adjust the treatments, and also educate the patients what food they have taken at the high sugar levels, or so modify their lifestyle according to that. And we also have insulin pump deliveries. This is one of the advancements which makes delivery of insulin very easy. So every time the child takes insulin, there is an injection in it. Here we already fixed the pump around the skin of the body. So the continuous glucose monitor communicates with the pump and advises how much insulin has to be given. It's like a smart mechanism.
Yes.
So there is no tension of pricking, no tension of thinking how much glucose the baby has, what food to eat. So all those things are taken out. And recent medications which we have got, like I say, long-acting insulin, they only allow us to take 2 times a day, morning and night. Because the previous versions what we had were for a shorter period of time. It works for 6 hours like that. So that time we have to take multiple times. Now we have ultra-long-acting also, daily ones also we have. So these advancements have made things easy for us also to treat the children.
Now, doctor, when the child with diabetes grows to an adult, how can they deal in the transition period, and what is your suggestion?
It's a very important question, because as the child grows, the child also becomes more aware. The child wants to be same like any other child or better than any other child. If the child reveals that he or she has diabetes for other children, for example, if they are playing and the child has to take a dose of insulin, or a child develops an attack of hypoglycemia, that is the low blood sugars, then it is an embarrassing moment for a child. This happens especially in the adolescent period, so where they're turning to be adults. Those of the times where we also see the child is not adhering to the treatment properly. When they go out for a camping, they don't carry the insulin with them. When they are in a group, they don't want to insert the insulin. That leads to a lot of attacks of hyperglycemias, diabetic ketoacidosis, all those things. So that moment, the psychologist intervention is very important. The counseling part is very important. We have to ensure that their treatment is properly taken care, and this is completely normal to take insulin. This is okay to be a diabetic child, and we should give the confidence. For that, what we do before they transitioning into adults, when they are children, that time itself we are making them to go to the adult diabetic clinic. So there is some overlapping of time. So they also see the world in the other side, in the diabetic clinic, adult diabetic clinic side. So then they get a confidence in themselves to transit. Yeah.
Can you explain some of the most rewarding aspects of working with pediatric patients with diabetes?
It is wonderful to work as a pediatrician and to treat children. See, when you see a child who was in a very tough situation, very sick child, and you treat and they come back to you as a healthy child, there is nothing more than rewarding than this, satisfaction. So as a pediatrician, we also see the clinical conditions, we also treat them. Parallelly, we also counsel the parents, we also counsel the child, and we are with them all the time, helping them to go through the ups and downs in the disease process and help them to understand it better every day, educate them parallelly, giving them the new technologies, helping them with the new treatments, and making them join the communities, because there are many diabetic communities in the Facebook, in the YouTube, even in the localities. So making them be in touch with them will also, like social medias, they be very comfortable. They also feel they are connected to the world, and they lead a normal life.
Doctor, we know about high blood sugars and low levels of blood sugar. So when the blood sugar is very low, how does the family know the blood sugar level is low, and what is the treatment option?
A very important question. This we face day-to-day life in a diabetic patient. So some treatment of diabetes can contribute for a low blood sugar.
Okay.
This we call as hypoglycemia. Hypoglycemia means the glucose levels less than 70 milligram per deciliter. During these episodes, you don't know the reading, but you can assess by the symptoms. So symptoms are like shakiness, what we call jitteriness, giddiness, perspiration, too much sweating, and convulsions. Sometimes the fits can come.
Okay.
So these are the symptoms. Sometimes the child may lose loss of consciousness. So during these episodes, it's very important to suspect early and check the blood sugars. When you know it is less than 70, you have to treat the patient. At home you can treat orally. In hospital there is a different scenario. In home we call it as a rule of 15. So we have to give 15 grams of sugar. For example, 3 ounces of soda or 6 glasses of small glass of juice, or you can also give 3 candies, 3-4 candies, like that. So something which is rich in sugars. You can also give chocolate, you can also give 2 spoons of sugars, whatever you can manage. So then after the 15 minutes, like 15 grams of sugar, after the 15 minutes, you check the sugar levels. It has to be more than 70. If it is less than 70, I want you to repeat the process again.
Okay. Likewise, what is high blood sugar, and how does the family know that the child is having high blood sugar?
This is the other end of the problem. When the child misses the insulin dose, or when during the illness the body is fighting against infection, that time the body needs more glucose levels. The body produces more glucose, or it may be during certain medications like cough syrup, cold syrup, or any steroid medications, the glucose tend to shoot very high. So high sugars is refined as more than 250, sometimes it is above 350. So now we have to clearly identify, is it because of lack of insulin, or is it because of excess food, or is it because of illness or any medications? One of the easiest way to identify is check the blood ketones. Where like a glucometer, we have ketometer. So you can check the ketone levels. For example, if the glucose levels are high and the ketones are normal, nothing to worry about. Over a period of time, with the regular medications, the glucose will settle. But if the glucose levels are high, parallelly the ketone levels are more, ketones are bad guys. They are acidic. They make the body, the blood turn to the acidic levels. That causes nausea, vomiting, pain abdomen, and many other complications like even shock also. So that is the situation where the child has to access medical advice. So the child has to be admitted, treated aggressively with the IV fluids. At that time the child does not require subcutaneous, the child requires IV insulin, like a continuous insulin has to go, and there is a set of protocol for treating it. So all these situations we have to be kept in mind.
Now doctor, before we wind up, what do you have to say about Al Hilal Healthcare?
Al Hilal Healthcare is one of the largest health service provider in Bahrain, and we are expanding. We have more than 8 centers now, 9th is about to be open, and we also have a very big social awareness program. This Friday, 8th of November, we are conducting a diabetic walkathon, which is always conducted annually. Last year it was a very successful program, and we also have lot of packages helping the diabetic people to frequently check their sugars. So every Friday we have a diabetic clinic workup. They can come with a huge discounted rates, and every day also we have a checkup with a very discounted packages. It makes us very satisfied to provide such kind of health service. We have diabetologists, we have a big pediatric team, we do have a lot of counseling team, dietitian teams, and constantly we are working on obesity. So this is what this is the best thing what we can provide to them.
Team also there.
Yes.
And thank you doctor, thank you for joining us. And it was a wonderful episode with a lot of valuable information about diabetes in children.
Thank you very much.
So viewers, I hope this was a wonderful episode, and if your child is having diabetes, don't panic, go for medical intervention on time and help him or her to lead a normal life. Till we meet again next time in yet another episode with a new topic, this is Jasseela Mujeeb signing off. Good night.